Thank you, Governor. Good afternoon, everyone. Thank you for being with us on a Thursday this week. As the Governor shared, we have 228 new cases to report. That's a reflection of needing to get everyone's attention. You see the flashing warning signs that the Governor shared so that we can make a difference right now. Our currently hospitalized number is 129 compared to 131 yesterday. There are 12 people in the intensive care unit throughout the state and 5 people on a ventilator. These numbers are similar to what we shared yesterday. We sadly have 2 new COVID-19 associated fatalities to report. Both individuals were in their 90s. Our prayers are with the families of these 2 cherished Rhode Islanders. And it's an example of why we are back here today. We want to work with all of you to be able to preserve the lives of Rhode Islanders going forward. Hopefully you've identified the theme of our conversation today. As the Governor has shared, we are getting much more serious when it comes to wearing masks. I see it as my responsibility as the physician to help you understand the science and the data that drives our push to you. We've said from the beginning that we're going to learn as we go, that things are going to evolve as we go through this pandemic. Prior to now, our messaging has been, and people have responded, to wearing masks out in public, keeping your environment structured, keeping your distance, make sure you're washing your hands. That has to continue. That is what has kept us in the place where we are now. As a region in the country, our numbers, and particularly our percent positivity, has been holding steady. And that's because people have done the work that we're talking about. Why we are here sounding the alarm is because we're seeing the warning signs. The numbers are creeping up. And so that means we have to do something more. We have to go beyond just wearing masks in public, in restaurants, in retail, while keeping those things open. The science and the data tells us that not only in public, but also when we're around friends, when we're around loved ones, when we're in a comfortable zone, in a personal space with people that we know and love, that is also the time to wear a mask. Just because they are individuals that you know, that look like they're fine, don't look like they're sick, you see them on a regular basis, they're always okay, COVID-19 can still spread. It is still spreading in those situations. Our data is showing us that again and again and again. Whether in your home with extended family members, in the place of worship setting as a social gathering, in a bar where people are mingling as we're telling them not to do, or in a workplace setting in a break room when your guards are down. That's the message we want to get across to you. That's the thing we need you to do differently so that we can stop the trend of the numbers that every state, particularly in this region, is seeing. Let's make Rhode Island the state that leads the way in changing the trajectory that's happening. This is how we do it. We, each of us, work together to be more vigilant with wearing our masks in those comfort zones, in those most casual, in our more casual spaces, and when we are with people that we know, that we're frequent with, that we love. That's when we need to wear our mask. The simplest way to think about it is mask wearing should now be the default. It used to be, maybe it could be the exception and you need to wear a mask. Now, let's shift it and make it so that mask wearing is the rule, and there are only very few exceptions. That one exception could be when you are with people that you live with from your own household, sharing a bathroom with, bedroom, that type of thing. That may be an exception. But if mom, grandmom, friend comes to visit in your home, wearing the mask is the default. That's the rule, and that's what we want everyone to take away from this. In the past, we said you should wear a mask. Now we're saying make wearing a mask your default, whether you're indoors or outdoors. We want you to always have your mask on and with you. If you're going for a walk with a friend, wear a mask. If you're in a backyard and there are people there that you don't live with, you need to wear a mask. If someone in your home, if someone comes to visit your home who doesn't live with you, or if you are in someone else's home, masks need to be worn. We're telling you the data shows us again and again those are the scenarios where COVID-19 is spreading. It's happening here in Rhode Island, and it's happening throughout our region. We are now saying wear your mask. It's the rule, not the exception, whenever you're around other people who you do not live with, period. Wear your mask whenever you're around other people who you do not live with. We're updating our guidance online to reflect this change, and it's all part of how our understanding about this virus evolves. When we are out in public around other people we don't know, we're generally good at wearing a mask. What we're asking is for us as a state to now take it to the next step and get those masks on in these additional settings, the comfortable settings, the personal settings, the casual settings, because COVID is spreading there. We know it's hard, but we know we can do this with all of us focusing on it together. In addition to updating the mask wearing guidance we have online, we've also posted information online at reopeningri.com to reflect the governor's announcements on Halloween, on break rooms, and on workplaces. Each of those settings, in a holiday, whether you're traveling or for upcoming Halloween, in a break room setting, in any workplace or casual gathering setting, those are the scenarios where masks need to be worn. We've seen cases associated with break rooms in all types of scenarios, and the true reason is just that's the situation where people's guards are down. They're eating, they're talking, they're taking a break from the structured setting, it's informal, it's unstructured, it's more casual, and people's guards are coming down. And so we're here today to say exactly when you feel that moment that you're comfortable and it's safe and it's okay. If you're not with someone who you don't live with, you need to be wearing a mask because it isn't comfortable, it isn't safe from a COVID-19 spreading standpoint. That's the message we want you to be able to have. As the governor said, business managers should encourage employees to be more creative in how they can take the breaks that they need to take. Eat lunch or take breaks outdoors whenever possible. In addition, we're reminding people about the need to limit the number of people who are in common areas at one time. Both of those situations, you need to continue to wear your masks. We're also asking business managers to post signs in common areas reminding employees about the 3 W's. Wear your mask, wash your hands, watch your distance. Another key is not having in-person office celebrations. That's yet another example of when people's guards are down, when they're feeling more comfortable, and they forget to wear their mask. Any situation that you can think of, whether you're an employer or an employee, clergy, teacher, principal, healthcare worker, think about all of those scenarios when people are in their comfort zone and their guards are down, and that's where we need to sound the alarm, whether it's a public setting, outdoors, or indoors. And as the governor said, if you can work remotely and still get the work done that needs to, please do it. That helps keep people outside of certain crowded situations, and no matter what, folks need to be able to wear their masks. If you're in a position at your workplace to get other people working remotely, do what you can to help make that happen. Also, to employers, the governor mentioned about carpooling. Think of creative ways. Maybe you can provide some support for your employees to be able to get to work safely. Those that have to ride together, wear your masks. Roll the window down, wear your masks. I want to finish with talking to our youth, our young adults who are out there. We are depending on you. This is the time where you have the opportunity as a young adult not to just disregard this message and say it doesn't apply to us. The youth, the young adults, 20s, 30s, 40s, the ones who feel fine, who have no symptoms, you are who we're talking to when we're saying, please heed this warning. Work with us. Help care for those who are more senior or those who have underlying illnesses by just wearing your masks. When you're with your friends hanging out, when you're in some form of small gathering, social event, when guards are down, wear your mask. Our Young Adult Task Force has come together to help come up with ways to do that. I want to put a call out to our youth. We believe in you. We're depending on you to be a part of this with us. We're letting everyone know what the science and the data is telling us. This is why we have to do something differently. And together, we can make sure that we have a different outcome in Rhode Island. So I'll just repeat that I'll be doing a Facebook Live tomorrow with Dr. Philip Chan from the Rhode Island Department of Health so that we can continue to discuss together what else we can and should be doing right now to prevent the spread of COVID-19. We can get through this together.